I'm Mark, a dental hygienist here at Premium Dental Hygiene Services, and this is my manual toothbrushing demonstration. When selecting a manual toothbrush, ensure that the toothbrush head has flat and uniform bristles. The most important area to clean when using a manual toothbrush is just here, where the gum meets the tooth. The plaque will form here first and work its way up and underneath the gum line, on the outside surfaces and also the inside surfaces. So it's important to ensure when brushing that the bristles touch this area on each tooth. Hold the toothbrush in a loose grip. Place it into the mouth and onto the tooth. Keep the toothbrush parallel and horizontal to the teeth, rather than like this, or like this, or like this. Keeping the toothbrush parallel and horizontal will allow the full face of the toothbrush head to be touching the whole surface of the tooth, ensuring a more effective clean. I will now alter my position to give a closer demonstration of when the bristles initially touch the tooth. When the bristles initially touch the tooth, they may be just here. Then move them towards the base of the gum line and the top of the tooth, touching that key area, and hold them there. This can be at a 45 degree to a 90 degree angle. Then you want to vibrate for 5 seconds. 5, 4, 3, 2, 1. Move on to the next tooth. 5, 4, 3, 2, 1. Work this all the way around the outside surfaces, doing 2 teeth at a time for 5 seconds. To the inside surfaces, again, ensuring that you're touching the base of the tooth and the top of the gum and the top surfaces of the teeth for 5 seconds. When you get to the front of the mouth on the inside, get the toothbrush up as high as you can, as far as the nose and face will allow. Keeping the toothbrush flat at this stage and horizontal will result in missing the base of the tooth. So placing it as high as you can will ensure you get this area and stop a layer of plaque forming in this area. A common mistake with this toothbrush is pressing too hard, like this. If you see the bristles like that, that will indicate that you're pressing too hard, and this can cause recession over time, causing the gum to go down and most likely causing sensitivity. Reduce the pressure. Do a nice gentle splay of the bristles. It's all that's necessary to remove the plaque. But do ensure, again, you're touching the top of the gum line and vibrating gently for 5 seconds. Once you've done this on the outside surfaces and the inside surfaces, to the top surfaces, to the upper and lower arch, and you should have a lovely smooth feeling on your teeth, as all the plaque will have been removed. This is my variation of manual toothbrushing. There are other variations out there, but this is the way that if my patients are using a manual toothbrush, I prefer them to use it. I just find it's the most effective way. However, an electric toothbrush is designed and clinically proven to remove more plaque from the tooth, and this will give you a much cleaner feeling in the mouth. If you are using a manual toothbrush, 3 extra tips when using it are to replace it every 10 to 12 weeks. After you finish brushing, don't rinse out with water. This just washes away all the ingredients inside the toothpaste that are there to protect the teeth. Just spit out the excess, leave the remaining on the teeth, and this will protect you for much longer throughout the day. And finally, if you do see bleeding when you spit or coming from an area inside the mouth, don't avoid that area. Continue with the technique as shown, and after 2 to 3 days, up until 2 weeks, this should resolve. If it doesn't, do book in to see a dental hygienist. This could be a sign of a more serious problem. And you can see my colleagues and myself here at Premium Dental Hygiene Services. All the links will be in the description below.